Good morning. My name is Ajay Kumar. I'm Chief Clinical Officer for Hartford Healthcare. As usual, I'm going to start with some updates on a number of patients we're caring across the Hartford Healthcare. We have about 6 patients in Bacchus Hospital at this time. Charlotte Hungerford still has 15 patients. Hartford Hospital has 108 patients. That's one of the significant decline we've had. As you know, Hartford was over 200 patients not long ago. Midstate Medical Center still has 15 patients. St. Vincent Medical Center has 71 patients. That's again a decline here. We had over 100 patients at St. Vincent only a few days ago. Hospital of Central Connecticut has 37 patients, and Wyndham Hospital has 4 patients who are positive at this time. So that's 256 patients. That's clearly a decline from yesterday and day before. We have in Community Network, 223 patients. That's one of the rising numbers. Behavioral Health Network has 1. As we've indicated, we are seeing this increase of patients who are positive now in our post-acute space, especially the nursing homes and assisted livings and other areas. So that's something we're keeping a very close eye on and managing as best we can at this time. Some of the questions have come up in the last 24 hours. I thought I'll just address as best I can, open for any further questions and answers, and I'm going to have my colleague, infectious disease specialist from a central region will join later on. But I do want to talk a little bit about surgeries. That keeps coming up, essential surgeries, and what are we doing and where the Hartford Healthcare's position is. Look, Hartford Healthcare has always been operating in the sense of urgent and emergent surgery. We've been doing it all along in this environment. We've always remained open and available for the patients actually who need our care. We have done that consistently and safely at this time. As we think about essential surgeries, our thinking has been that the individuals who put off their surgeries for whatever the reasons, and they're suffering at this time, they've got pain and other issues. So our surgeons and other colleagues are working with patients at this time, trying to engage them and trying to see who needs to come back safely. And gradually, we want to ramp it up. We want to ramp it up with the idea that we remain safe. We have adequate PPE. We have all the infection prevention protocols in place. Our community understands what they need to do. Our visitation needs to be streamlined. So we're looking at all possible angles at the same time to make sure we, as we resume these essential work, we do it with all the safety and engagement of the patients at this time. And that's our philosophy, to make sure we remain safe at this time. And we're going to scale up gradually, and we're going to see how our community performs in the sense of outbreaks and sense of what the COVID-19 numbers are going to look like. So we're going to measure that, and we're going to look into it very carefully. In preparation of that, we've actually trained more than 70 individuals across the system who can really work like a SWAT team. If you find some area where there's a possible infection, so our team can go there and analyze and stop the process and make sure that we do a contact tracing to the extent. We're optimizing our testing at this time. For example, any patients who's going to be scheduled for any procedure will actually have a testing done to make sure they're negative before they come for surgical procedure. So a series of steps will be taken, and we have already began taking that to make sure that we are safe. Our goal is not to get to the maximum level as soon as possible. That is not our goal. Our goal is to make sure we ramp it up in a way which is thoughtful, methodical, disciplined, with safety in mind, safety of our colleagues and safety of the patients as well. With that said, one of the common question which comes up about the PPE, do we have adequate supply? How are we positioning that? So let me be very clear that Hartford Healthcare, from the beginning, we've always worked very hard to get the supplies in the right level. We've worked with supply chain and our parts and counterparts to make sure we have the right amount of adequate supplies in the organization. We've also looked into CDC's guidelines. We also look into a variety of national guidelines. Our process of how the PPE is allocated to the nurses and doctors and respiratory therapists or anybody else it's a pretty intense process where we have a significant number of clinicians and nursing leaders and other members give their input, looking at the guidelines, looking at not just the CDC, but the society guidelines as well, which comes out. And then we create a consensus of how we roll this out. We've done that consistently, and so we've been ahead of that. Safety remains a paramount concern when we discuss about these. We are consistent with our guidelines with DPH and CDC. We are doing better or just as much or just as well as CDC is advising at the moment. We compare our guidelines to several national hospitals as well, New York-based, and Cleveland Clinic, and Mayo, many other places. And we consistently, every weekly, we have a cadence of reevaluating ourselves on how we're doing it. So I feel very comfortable at this time. I'm very confident, in fact, that the policies we put together regarding the PPE are the safest one for our colleagues across the system. And with the universal masking of individuals who are working in Hartford Healthcare and providing the mask for people who are coming with visitors and patients and all that, we feel comfortable. We've created as safe an environment as we can create. Now, the challenge is the community spread. As we continue to see the numbers of COVID positive rising across the country, throughout the nation, actually, we're still seeing the uptick here. So that tells me the community spread is going to continue at this time. So that creates a challenge for all of us as members of the society, is that how do we make sure that we provide the safe care while we know the number of patients who are being infected are still on the rise across the country. And that's the fine balance we're trying to strike here in Hartford Healthcare. And all the planning and all the work we have done, I feel very confident that my teams across the system have done a tremendous job to position us to be able to do that. With that said, I think there are a few other questions which had come up. Telehealth and virtual health, where are we heading with that? As you know, we have more than 82,000 as of last evening visits completed across the system. Our goal had been, from the virtual health and telehealth perspective, to remain accessible to our community, to be able to connect with our clinicians and specialists and our services to provide the care. And the care not just in the primary care or specialty care, but behavioral as well, because we understand there's a significant concern right now. We are hearing about the post-COVID burnout and the issues which our society is going to face, unfortunately. So we are positioning ourselves in a service-oriented fashion with the virtual health accessibility. I think it's going to continue to evolve. We're going to continue to fine-tune that and make it better as we go forward. Our focus has been try to create more accessibility on that side, and we've been very successful in that. And a lot of feedback we've received from our patients at this time has been very positive in that sense. So we're very fortunate to be able to stand up that service in such a short time. At this time, I'm going to invite my colleague, Dr. Virginia Bielek, who's the Chief of Infectious Disease at the Hospital of Central Connecticut, and she's going to be talking about Remdesivir. Thank you. Virginia?
Hi, good morning. I am Dr. Virginia Bielek. I'm Chief of Infectious Diseases at the Hospital of Central Connecticut and Regional Director for the Central Region of Hartford Healthcare. As most of you already know, based on preliminary data from studies of Remdesivir, the antiviral agent active against COVID-19, the FDA issued an emergency use authorization for this drug for patients hospitalized with severe COVID-19 infection. Use of this medication was authorized based on results of a randomized trial of Remdesivir versus placebo for patients infected with COVID-19. That study demonstrated a significantly shorter time to recovery in patients receiving Remdesivir, 11 days versus 15 days, as well as a lower death rate of 8 versus 11%, although that was not statistically significant. Hartford Healthcare received its initial allotment of Remdesivir on Saturday and immediately began distributing this medication to all of the hospitals in the system. Patients who met criteria were able to receive this medication at the Hospital of Central Connecticut starting early on Sunday. We as physicians and other healthcare workers and our patients are extremely grateful to many, many people who worked hard over this past weekend to make this treatment available to our patients. In addition to the emergency use authorization, the Hospital of Central Connecticut was invited several weeks ago to apply for the Gilead Pharmaceutical Expanded Access Program for the use of Remdesivir in critically ill patients who are on a ventilator. This program allows us to expand use of this medication to seriously ill patients with COVID-19 in our hospital. Our hospital was activated as an expanded access site yesterday, and we anticipate beginning to enroll patients soon. We are required to very closely monitor these patients and to report outcome data as well as side effect data to the manufacturer of this medication under this program. Again, many, many individuals throughout Hartford Healthcare worked many long hours to make this program possible, and we as physicians extend our gratitude to everyone who is helping care for our patients. Thank you very much.
Thank you, Virginia. I'll open for any questions at this time.
Dr. Kumar, this is Pat Edenrob with the Associated Press. Can you talk about this pediatric inflammation syndrome that we've been hearing about? We understand there are some patients in the Hartford healthcare system with it. How many, how concerned are you about this? And are you going back and looking to see if there were people who had not been diagnosed with this in the past?
I think, thank you for asking this question. If I could be a bit more specific, you're asking about the syndrome of Kawasaki disease-like syndrome we are experiencing and we're finding in some of the reports coming from New York and other states in children. It's affecting the children of younger age group in around 4 to 8 or 9-year-old at the moment. I'm not aware of any similar disease in the adult population at this time. This is unfortunate what we're seeing, especially in the children area where this is affecting the vessels and affecting the heart functions on those individuals. I'm not aware of any case in Hartford Healthcare of that type. We are going to have one of our specialists, Dr. Anne-Marie Goliotto, come to the media briefing one of these days this week to talk a bit more about it and provide some more clinical details around that. I do want to highlight that this COVID-19 has really challenged us significantly. It has presented in the most unusual ways and affected our patients in interesting ways. One of the significant challenges we had seen, individuals who are infected with COVID-19 had a higher risk of blood clotting disorders. And this was a report which is coming out from China and other places as well. So Hartford Healthcare instituted a protocol very early on to prevent that happening. And we've seen actually the increased number of patients. We've been able to prevent those kind of a poor outcome because we are already anticoagulating them. Now, there was an interesting case report came out from Germany indicating that they've gone back and did the autopsy on individuals actually who passed away, and they found a fair amount of individuals in the adult population did actually have complications related to blood clotting disorders. Now, we haven't got a widespread details on the autopsy side, but at least we're doing all we can to prevent that happening. And our protocols incorporate all the precautions at this time. Regarding the children, I've indicated before I'm not a pediatrician, so I don't want to misspeak. We're going to have one of our colleagues and give us some more details this week, and Tina will confirm which day that would be.
Okay, but you have not heard of anything at CCMC?
As you know, CCMC is not part of Hartford Healthcare. I do speak to the colleague. I spoke to them 3 days ago, and I hadn't heard anything of that sort. Since the last 3 days, I haven't asked this question again.
Thank you.
You're welcome.
Hi, Dr. Kumar. This is Danielle with WTIC. I was just wondering if you could talk about the status of the hospital setup that you had at the convention center and how that's looking and what's going on there.
You're talking about the extended sites. You're talking about the extra capacity we had built during the surge time. Am I correct?
Right, yeah.
Yeah, so we were fortunate to have support from our National Guard to be able to erect a 620-something bed hospital in the convention site, and we were ready for what is to come. And it's always the hindsight is 2020. You want to be always over-prepared in these kind of situations, and we were in that stage where we had prepared ourselves very well. Fortunately, we have not required to use that area for any patient care activity, so those sites were not used as of right now. Sites remain active. However, we have reduced the number of staffing available at this time for those areas because we don't anticipate at this time immediate need. My concern has always been about our nursing homes and our SNFs and assisted living, as I've spoken several times. And we're hoping that we would not come to the place where we need that, but those sites are still available. They're not being used.
So just to confirm, there are no patients there currently?
Not from Hartford Healthcare.
Okay. Does that mean there are from other
No,
locations of Connecticut?
No, I'm sorry. No, in convention center, we don't have any patients. I'm sorry.
Okay.
What I
That's okay, just to clarify.
Yeah, that's fine. Thank you.
And the only other question I have is, has there been any talk about, taking it down or anything like that?
I'm not close to that because FEMA and State Department will advise on that part here. So to my knowledge, there is no talk right now, as of right now. But I could be, I don't want to mislead you. I think we'll get a better answer for you, hopefully in a day or two. But that would be determined by the state's direction.
Okay, thank you.
You're welcome. Any other questions?
Dr. Bieluch, this is Roger from Channel 3 Eyewitness News. I was wondering if you could explain what becoming an expanded access site for this drug will mean for patients and what kind of factors determine whether or not a patient will get this drug.
The expanded access program is for a very well-defined group of patients who are in the intensive care unit and on mechanical ventilation. The purpose of this is to collect more data, particularly safety data for transmission back to the pharmaceutical company, so that if and when this drug is finally approved by the FDA, we have a better understanding of what the potential toxicity profile is. It is a supplement, and many patients under the expanded use authorization would not qualify for this drug, but they would under the expanded access program through the pharmaceutical company. The expanded access program requires a lot of reporting. I've been fortunate to work with a wonderful group of people in the research division at Hartford Healthcare that have helped me set this up. It requires authorization from our institutional review board. It requires help from our computer people to set up the particular order sets that we need for use of this medication. And it will require patient consent to enter into this part of the medication distribution process.
Thank you. Dr. Kumar, this is Emily from The Current. I had some questions for you about the Abbott ID Now test. You said last week that the Hartford Healthcare hasn't been using that test because of the concern about false negatives. Can you tell me where that concern came from? Did Hartford Healthcare do a study, or was that found in the validation process? How did that concern come up for you guys?
You're talking about antibody tests or Abbott tests? I'm sorry, I just want to be clear.
Oh, sorry. The Abbott ID Now test.
Abbott test, I think this is a national report here. There is a 15% possibility, a 15% false negative report. Actually, it's been published by a variety of different sources. The Hartford Healthcare did not complete the validation. We were beginning stages right now on that part here because we were concerned about the false negative rate on that part here. And it's actually come up in several different organizations as well about the false negative rate as well. So we shied away from that, and we want to make sure we use the Cepheid platform and the other platforms we've tested and verified for antigen testing. So we've been very careful about that.
And do you plan to complete the validation process at some point for the ID Now test, or is that just on the back burner?
Our lab team is still working on it. I must admit, Emily, that I haven't asked the update on that for the last several days right now, so I will try to find out where we are right now. Thanks for reminding. But we have 4 machines, so I'll find out on that part.
Okay, thank you.
You're welcome.
Hi, Dr. Kumar. It's Bridget from the Republican.
Hi, Bridget.
I have some questions about the pediatric cases,
Yep.
but I think maybe we should wait until there's an expert to answer those questions.
Can other individuals mute yourself? There's a lot of feedback I'm getting right now. Who's not speaking? Thank you. So maybe all of you can mute yourself. Let me speak on that part for a second. Thank you. Thank you.
can't hear very well, but
Bridget, I got it.
Just looking for more clarification on the pediatric cases. I know that you haven't seen any cases there, but maybe retroactively, are you looking back to what may have occurred that wasn't classified as COVID, possibly?
You know, we have no evidence in adult population this Kawasaki type disease has occurred. I just want to be clear, this particular disease actually affects the vessels, the arteries, which actually supply the blood, and it causes inflammation, which leads to a heart failure and other challenges. What we have seen in adult population is generally a respiratory disease-related mortality. And we've seen second-type mortality, which is a blood clotting disorder mortality. Now, I indicate the blood clotting related issue, we've already addressed it by giving appropriate prophylaxis to all the patients who come from COVID in Hartford Healthcare. So I feel comfortable that they were covered with the best medications and treatment at the time here. The other mortality or the death which is occurring because of respiratory issues, which we talked about, the stiff lung, the ARDS type picture, is what has been the most fatal occurrence here. We have no evidence of the Kawasaki-like disease occurring in our adult population. Now, it's somewhat difficult to know unless you do have autopsy on all individuals into a study, which we have not done, and I do not know any country or any of the region has performed of that level of autopsy. What we have learned from Germany, some of the studies out there, that they found some evidence of blood clotting related mortality in adult population, but not the Kawasaki type. So it seems to be the Kawasaki type disease is very specific to the children's only. And it's happening in a very small age range of the children population as well. I think there would be a lot more information coming over the next several days. Once Dr. Goliota is on the podium, she can talk a little bit more about that in detail. But I want to assure that at least in adult population, we have not seen that disease.
Okay, and one more question. As the numbers go down for hospitalization, are you sensing, determining that there's a lesser degree of illness in those people who are being hospitalized or by the time they arrive?
No, not necessarily. Actually, we are seeing the intensity of the disease is just the same as before. There is no change in that sense here. It's just the number of patients who are coming to the hospital being admitted are lower at this time because we have, obviously, what we consider the peak of the surge of the number of patients who are getting infected in every single day in our community is lower now than it was before. So in relative form, patients are still coming in. They're just as sick as they were before. Our ventilation use for the percentage-wise, just about the same. Our therapies, obviously, utilization is same. Obviously, having something like convalescent plasma, Remdesivir, allows us to do a bit better job than we were doing 2 weeks or 3 weeks ago. So obviously things have changed. And as I indicated earlier on, look, our best bet to fight this disease relies on several different things. One, increased testing, increased isolation, increased contact tracing, better medications, which we are seeing right now with Remdesivir and convalescent plasma and vaccine. So this is the kind of entire armamentarium we have for fighting the COVID-19. And as time goes by, we're going to learn more about these modalities, and hopefully we'll manage this disease.
And the MIT model does show that it will continue to decline through the summer?
Yes, one of the most challenging aspects of our modeling, as I indicated earlier on, the human behavior, to predict that part here. That is something we continue to struggle with. As you know, the social distancing or physical distancing, however you define that, remains my concern, and remains concern to most of the clinicians, I would imagine. And if you see when the warm weather comes in, the good thing is the warm weather, but at the same time, people do like to congregate, people do like to get together. And concern is obviously people are getting a little tired of being social isolation. I highly encourage people to continue to focus on that part. That is one area which we cannot let our guards down. As soon as we have this congregation occurring, we're going to see the resurgence of this virus. We're going to be back to square one and trying to figure this out, how do we contain and manage. And frankly, what happens is the most vulnerable population in our community gets affected and suffers a mortality and the loss of life and other things. We have options as a society to prevent that and manage it. Not perfect, but at least some options. One option is to continue to focus on social distancing. We need to continue that discipline for a long time to come, till we have better therapies or vaccines and other things available to in our tools box, which we don't have it right now. So I think that is where the MIT model or any model across the country, as you see, that keeps changing, can fail. It can't be accurate because we can't predict the human behavior completely.
Thank you.
You're welcome.
Dr. Kumar, it's Lisa at News 8. Can you tell me, do you anticipate your MIT model to be extended past June 15th?
Yeah, we do.
Also, my second question is about nursing homes. I think you touched on a rise in some nursing home cases, and I know that's been a big concern of yours all along. If you could talk any more about that.
Yeah. So, yeah, MIT model will be extended. And we would have some more details come through that part here. And actually, last 2 days I've been having conversation about, is there any way to predict our social behaviors and how it impacts the modeling? And it's been we're trying to figure this out. How do we actually optimize that part here? On the nursing homes and the SNFs and assisted living, as you probably are reading, it's becoming a national issue, and it's a known issue for us. Look, it's a challenging task. The nursing homes have a significant amount of challenges, especially the kind of populations they have, which are highly vulnerable population. The mobility is a factor. Some of the individuals are demented, and they need to be managed differently, and they need a close contact at times to be able to take care of them. We did several measures across the state and within the Hartford Healthcare, is reducing the visitations and creating some sort of protections for our most loved ones in our nursing homes. However, this is a very challenging population to manage at this time here. So what we have seen, as you look at the numbers across the country, and especially some of the results, details coming out from different states, neighboring states right now, a lot of mortality is happening in that area, that world, which is the post-acute, which is a SNF and assisted living at this time here. And we've seen the same 52 to 54%, depending on which week you look into the numbers of mortality across Connecticut, is in that range as well, in that local area as well. So the challenge we have is that you have individuals who are very vulnerable. They're clustered in one area, and we've done all the visitation restrictions and all the policies and procedures as well. But there's still a possibility of introduction of the virus from different places, in the sense of how the caregivers are migrating from one area to the other area, the community spread of people are exposed to who are working in those areas. And despite all the precautions, we've seen some challenges in managing that part here. And that is my concern. As we go further in the summer and in the winter, we're going to see a ongoing activity. I hope not higher, but ongoing activity, and we're going to see increased mortality, especially in that population, and that's one of the biggest concerns, at least I have. Tina, any questions on Facebook? Okay, very good. Well, I think there's no other questions, then I'll adjourn the discussion today. Well, thank you very much for being here. We'll see you tomorrow, and I'll definitely bring pediatric specialist to have a conversation on that part. Thank you.